Cerebral palsy is an orthopedic impairment, which is a physical impairment that can affect the motor skill abilities of a student. Cerebral refers to the cerebrum in the brain, which controls motor function, and palsy refers to voluntary movement paralysis. 1 in 400 children are diagnosed with cerebral palsy. Because cerebral palsy is the most common disability among children, it is important to understand how to best meet the needs of students with CP. Cerebral palsy is a condition that is caused when a child's brain is not able to develop normatively because of a lack of oxygen to the brain, whether as a fetus in the first few months after birth or due to infection or injury. Cerebral palsy is a lifelong condition. It does not improve or get worse, but symptoms can change as a child grows. While a child with cerebral palsy might not produce obvious symptoms at birth, these symptoms typically become noticeable before a child is 2 or 3 years old, as children demonstrate difficulty reaching physical development milestones. There are multiple types of CP, and the most common is called spastic cerebral palsy, making up over 70% of the diagnoses of CP in children. This is characterized by muscle stiffness or jerky movements. While cerebral palsy can affect every child differently, some physical characteristics that identify a child with the condition might include difficulty with muscle coordination. Some students might have difficulty with walking or running, muscle spasms, tremors in hands, walking on tiptoes, show clumsy physical movements, or have weak arms or legs. Sometimes children with cerebral palsy can have coexisting conditions such as ADHD, epilepsy, or speech disorders, but this is not cerebral palsy itself. Children with cerebral palsy may also present learning disabilities, speech or language disorders, or visual or hearing impairments. This condition presents itself differently in different children, so it's important to get to know the child and their families as you learn to meet the needs of specific learning and behavioral characteristics of children in the classroom. You might notice that students with cerebral palsy will use a wheelchair, crutches, or other devices to assist movement or walking, or communication devices such as a laptop or iPad. Make sure that your classroom has the space to accommodate these physical needs so the learning space is accessible for all children, including those with orthopedic impairments. To teach students with cerebral palsy, first, meet with their families and learn the specific symptoms that your student might present in class, and ask how you can best support their learning needs. Don't make assumptions about a student's abilities, interests, or desires. You might have an athlete, artist, writer, or actor in your very own classroom. Always ask about the strengths and interests of your students and any strategies that are most successful at home in giving your child the best support. In the classroom, ensure that instructions are clear and brief, and provide all instructions visually, orally, and in written form. Include memory prompts and provide checklists and graphic organizers to help students stay focused. If written responses are difficult for a student with CP, your team might provide alternative options to handwriting and copy work, like providing assistive technology, including text-to-speech or digital typing software. Some students with CP might have a personal response device, such as a tablet, which allows students to connect with a teacher and provide answers with an iPad. It is absolutely vital that students with cerebral palsy are given the same chances to participate in large group, small group, and table talk discussions with their teacher and classmates. Ensure that you are familiar with the assistive technology your student might be using, and get comfortable with communicating frequently and openly with a student using their method of communication. Support the student's emotional well-being by developing signals or cues that remind them that you care. Help them stay on task by using these cues without drawing attention to that student. You can help facilitate social engagement by teaching peers how to interact with the student using their communication device if they have one, and making a wheelchair-accessible space in your class. Ensure that your classroom is always wheelchair accessible for every activity, and that there is room to move around using crutches or other movement devices. Make sure that activities are always at an accessible height for all students, and that students with CP can play together by providing accessible, inclusive playgrounds, choice and selection in sports and recreation. Teachers, parents, and support workers should strive to place students with cerebral palsy in a general education setting. Students with physical disabilities should be accommodated in general education settings and given the same access to opportunities within an equitable system that supports them in their individual learning growth. This is so important. According to IDEA, Individual with Disabilities Education Act, there is a difference between a child that has a disability and a child that requires special education. Having cerebral palsy does not necessarily mean that a child will require special education services on an individual basis and should be determined by the child's parents and teacher. Individuals with cerebral palsy have a right to learn, and a physically accessible classroom that exposes students to diversity of neuro and physical abilities is a way to make our world safer for those on the margins. According to IDEA, a child's placement must be determined at least annually based on the child's IEP and be as close as possible to the child's home. If it is the case that a child is not able to participate in a general education setting because of physical or neurological limitations, it is advisable to provide a specialized educational setting for that child. A special education program should be provided within the IDEA guidelines. Remember, this is not a one-size-fits-all approach. Most children with CP will be active, engaged members of their classroom and school and communities. And younger kids might wish to learn about cerebral palsy because it will help them be a better friend and community member. There are some great books that tell stories focused on kids with cerebral palsy, like Taking Cerebral Palsy to School. Students might also love the book Xander's Cerebral Palsy Superpowers. Or as kids get older, they might love the memoir by 14-year-old Erin Phillip called This Kid Can Fly. Or stories about students living in wheelchairs, such as Roll With It. Reading together is such a great way to support a learning environment based on empathy and compassion. Parents and co-teachers hoping to learn more about cerebral palsy should visit cpresource.org, which has a wide selection of videos that support educators, information about how to offer accessible classrooms, and suggestions for how to best support our students' needs. Together, we can all work to support students with CP in our communities.